Welcome back to our channel, Libra Aesthetics and Wellness. I'm Aisha Thomas, MD, the Medical Director.
And I'm Lisa Parker, a nurse practitioner.
And today's topic is on acne. So if you want to learn more about this topic, then keep on watching. So, what is acne? Well, acne, I guess, is an inflammatory disease that affects the sebaceous glands or the oil glands. And this particularly affects people when they go through puberty. And at that time, when you go through those changes, you may have quite a big impact on your physical appearance as well as your psychological appearance.
Very much so.
I don't know if you had acne, but I did growing up, and it does affect you because you're like, man, oh boy, these zits are popping up. I can't do this. I want to have my good side. Should I hide it with some hair or something, you know?
All the time.
And even older, when you're older now, you could have acne for different reasons. And let's talk about some of the reasons that can cause acne. A lot of people might think, oh, because, we're not washing our face well. And that's not necessarily why.
Right.
I did say it affects the sebaceous glands. So yes, it's more prone in people with oily skin. When you have oily skin or an overproduction of sebum, it can be a cause for acne because it can cause a little bit of plugging up of those, like a little tube that comes out bringing the oil to the surface of the skin. And there's a particular bacteria that can get in there, which is Propionibacterium acnes, or P. acnes for short. And because of that, the bacteria get in there, and then you find you have some swelling, and some of the top layer of the skin may close off, and you may find it might show off as different ways. You might have a white head because it's closed, or you might have a black head because it oxidizes because a little bit of air can get in.
Right.
And in severe cases, you have those cysts, which are so painful.
Painful.
Man. So, so, it's important to know the reasons why it happens so you can think of ways that you can help, alleviate these issues. So some of the other things are, other than mentioning the oily skin, are hormones. We talked about hormones last time here, and those little messengers go throughout the body, sending signals, and things can go haywire. You find that at certain times of the month, especially in women, for example, I noticed that in myself, you might find one or two hormonal acne bumps that might pop up on the lower part of your face, and so on. And sometimes in persons, because of GI issues, because we have hormones in our guts as well, they might pop up somewhere in the forehead, for example. And these can be things that are triggered by the hormones. Other things that can be part of the factors, genetics. Yeah, genetics always play a role because I know, as I got it from my mom, I can tell you, because I kind of look like her, and I did pick up her skin as well. And that's something you can see passing from, generation to generation there. Other factors that may, affect why people have acne, of course, diet is huge.
Very much so.
Foods high in the glycemic index, we talked about the high fructose corn syrup and things like that can cause, in a lot of people who are predisposed to have acne. And also in some people, lactose as well. So some people find dairy can trigger them to have acne. And in other persons, nuts. I definitely find peanuts break me out. So nuts can do that as well. And certain oils can cause a breakout in individuals. Some people break out due to spices. Certain spicy foods can break people out. And certain fatty meats. So you might find as you go throughout your life, you might find different things can be your trigger. And you might say, you know what, I'll avoid eating cheese, I'll avoid eating this. And sometimes that's what you have to do. You just clean up your diet and you say, let me introduce foods one at a time.
One at a time.
And then you see kind of what could be the factors that affect you. I'll go through a little bit in terms of the medical treatment of acne, and then Lisa will go into more of the naturopathic, the natural ways, and of course the lasers and the IPL and the other things we can offer there. Because of course treating it is the more, the more interesting part. Because trying to fix the problem is what we really love. So in terms of things that you can do on a topical basis, if it's mild, you can use something like benzoyl peroxide. You can get that over the counter. You can find it in soaps. You can find it in lotions. Something I like to do is to use, of course, a salicylic acid, like a 2% salicylic acid as a wash, because it won't stay on my skin all the time. I might but use them at different times. Like in the AM, you can wash your skin with a salicylic acid wash, and in the evening, you can put on a benzoyl peroxide lotion. For example, if your acne is mild, that might do the trick. If your skin's oily, don't think you don't need to moisturize, because sometimes your oil glands go a little bit haywire because they're producing too much oil because your skin is actually dry. Right. So you want to make sure you moisturize as well to keep that balance. Keep your pH balanced by using the products that are not too harsh on the skin, because some people feel like, I have acne, let me go out and use carbolic acid soap or something like that, or some kind of a really strong detergent. You want to use something mild, something gentle, because you don't want to disturb that pH balance on your skin. And there's a nice sort of oil and water surface on your skin that you want to keep intact. Another thing you can do, if your acne is more moderate, a lot of times you might have to see a physician, a dermatologist for that. But things like retin-A are useful because they can cause, when I mentioned that a lot of times the epidermis or the top layer of skin can clog up those little pores. The retin-A helps with the skin and the cell turnover, and it keeps those pores open. So that's very helpful to help the oil to flow through, and it doesn't get clogged as much. These along that same line, things like adaptoline can be good, and that's now over the counter. It is. So you can use that as well. You might go into need an antibiotics, especially when you have the cystic acne and you have the acne that's sort of super infected with bacteria. So tetracycline is good for those. Macrolides, you might find that we put people on things like tetracycline and doxycycline, depending on your age group, because we don't want to cause discoloration of your teeth and certain things like that. And vitamin A derivatives can be helpful. And of course, if we think it's hormonal, in certain people we might have to use a birth control method to sort of just regulate your hormones, depending if that's necessary. And one of the more harsher methods for people who have severe cystic acne is something like Accutane, but that's something I wouldn't take lightly, because that really does quite a havoc on your endocrine system. So that's something to really, before we head that way, I would say maybe talk about the natural stuff and the IPL before heading into wanting to necessarily do something like Accutane. And of course, the natural stuff is always good, because like I say, some things are always free. Like you say, your diet is not necessarily free, but it's cheaper than having to do a lot of those medicines, right?
Correct.
So work on the things we mentioned with the, avoid the lactose, the fatty meats, the high glycemic foods, the sodas, avoid those.
Right.
And see how you do with that. And also, a lot of rest is very helpful. Try a good regimen, and of course try it for a while before you give up on it. You need to give things a good 2 to 3 weeks before you say it doesn't work. Some people rotate things very quickly and say, oh, it doesn't work for my skin, but you do have to give things a little bit of time. And of course, as you go forward with your routine, you'll see a benefit.
I agree. I was going to say a tincture of time is truly what you're going to need as far as taking care of this acne situation. Switching products too quickly, it just confuses everything, because you're starting one, going one, maybe burn your skin, not working good enough. I mean, take your time with it. And also, I think when you were mentioning the sleep, that is a great thing to do. And during the middle of the week, I would also suggest changing out your pillowcases a little bit more frequently in between as well, because because you're using product, you're getting stuff on the pillow. We're trying to do a good cleansing and a good healing along the way. And I just think that that's kind of a good tip to be included in as far as helping you guys there. As far as some natural products that you can use along with your diet change, which is close to free as you can get. You're not purchasing certain things like sodas, hint, hint, wink, wink, high glycemic index items, maybe a little bit of tea tree oil. It's actually, I did a little bit of research on it, because I go, where is the tea tree oil from? I hear it all the time. A little side note, because I hear about it using with lice, okay? I had a child in elementary school, and that's always the big thing. So I always heard about tea tree oil. You always put a little dab inside of your hair. I go, So where is it from? It's actually from leaves of a native tree from Australia. Little side note. Anyways, it's known for its properties of fighting bacteria. It also is known to help reduce inflammation. So that being said, when you use the tea tree oil, you want to use it in an oil carrier, and you also only want to put it directly on the spots that are affected. So you don't want to just lather it on and put it on your whole entire face. Just spot nutrient. Yeah, just treat it on your spots there. So I also looked into essential oils because I go, a lot of people are doing essential oils these days, natural, which is a great thing, and they're easily found everywhere in a lot of pharmacies, and a little bit does go a long way. And they also go in carrier oils. So I saw rose, lavender, cinnamon, and clove. And clove, actually, there's a huge study done on the clove essential oil, and that one got the best results from the acne fighting the bacteria and also the inflammation. So I would suggest clove first, cinnamon next, lavender, then rose. So if you have them already, they're already in your home, you're using them for the smell of your home, you can also use them to help treat acne or someone that you know, so you can gift it to them. Hint, hint, wink, wink, holidays are around the corner. So
I will interject one thing.
Yeah.
There is something about essential oils. They could be a little bit, sometimes in the sun, it can cause a little photosensitivity in some patients. You might want to do a little spot treatment, like try it on your maybe inside of your arm, just to make sure you don't have a reaction. Some people may tend to do that with the essential oils. But most people will do fine.
Well, that's a good idea. And that one too is just on your spots too. So don't lather it on your whole entire face or anything like that, or where you're getting them, neck, on back, anything like that. Also green tea, it contains flavonoids and tannins, which are known to help fight inflammation and the bacteria that causes pimples as well. So it's high with the antioxidants, and it's been shown to help reduce sebum production, which is great because this is what we're trying to help reduce, is clogging of the pores. So that's just wonderful. And you were exactly right when you said, when you're thinking that you have too much acne going on, you don't want to moisturize, but that's exactly what you do. You just confuse yourself. You're like, oh, it's feeling a little too dry after you cleanse your face. And if you're not moisturizing, your face is like, oh no, I don't have any moisturizer. And then it's produces, and then you're like overproduction, and then the cycle therein starts again. So just a little tip there. And also I did a little bit of research on some fish oil, because we know that how great fish oil is for inflammation in the body. I said, does fish oil work outside of the body? And in fact it does. And there was 3 studies that I saw that actually said that if you use fish oil spotting on each one of the places of acne too, it also does reduce inflammation. So that was pretty cool to see that it also works on the outside as well as the inside.
No wonder you need the rose too, balance the smell out.
Yeah. Well, it also helps keep your skin hydrated. So I guess the feeling of your skin feeling really dry, it's not going to give that feeling. So that's good. Yeah, as far as the smell, you're right. I don't know what kind of carrier oil that would go in. Not sure. So vitamins. So vitamin A is great to be used on the topical side. So as far as taking it orally, it's just known to help reduce oil production as well. So that makes complete sense since it's used topically in that way. So taking it orally, it kind of has the same essence as far as that goes. Oral supplements of vitamin B3 has also been proven to reduce oil production and the actual shine of the skin. So I guess that's a great thing, because then it just helps reduce clogging of the pores as well. Zinc also helps reduce the acne causing bacteria that's on your skin, with decreasing inflammation of the actual hair follicle, which is great because we know once these get inflamed, they really cause a lot of pain. I mean, they really do. And vitamin E is also helpful with cellular turnover. So that's helpful with fighting free radicals as well. So just keeping your skin nice and plump and keeping it nice and fresh. And it's not gonna cure the acne, but it at least helps with the inflammation and the discomfort that you have as far as that goes.
So if we see you here in the clinic to assess and evaluate you for acne, what we'll generally tend to do is to first see what is your level of acne. We'll assess your skin type and we'll see whether you have a mild, moderate, or severe form of acne. And of course, according to your age group, we'll determine whether or not you need something topical, you need something oral, and we'll decide if maybe an IPL treatment might be good for you. That's the, of course, the intense pulse light, because that one has been found in studies to be very beneficial in killing that bacteria, which we talked about, that Propernum acnes, that P. acnes, which can cause especially an inflammatory acne. And that IPL machine can also help with the post-acne hyperpigmentation, and it can also help with the scarring. So, depending on what setting we put it on, we can help you to get that skin rejuvenation that you would need.
Exactly.
Because we mentioned how that psychological effect can be. I mean, when you have the scarring, especially as you go through the transitioning years of, being a teen and a young adult, it can really hamper, how you feel.
Exactly.
So let's feel our best, inside and out.
That's right.
So at least you have a little thing to mention about what you thought about the IPL results so far.
I have loved the results from the IPL. In fact, there's been a couple of patients that I've prepped their skin to get them ready to receive the IPL treatments. And once we get them ready to go, the skin is great. I do a couple passes on there. It is a series of treatments. It's awesome. We get it going, reduces the acne, reduces the discoloration, or the hyperpigmentation, I should say, and you feel great. You actually see the young adults come from being inside of a shell to actually coming into their own. They're just feeling a lot more comfortable and better about the way that they look and the way that they feel. And it's just a transformation that you just really can appreciate and love to be a part of.
Yeah.
Yes,
I see that little glint in your eyes there.
Yeah, it is.
Because that's the favorite thing about, when you can help someone. It really
is wonderful. It is, and it's not a quick change. Like we said, you were saying earlier about how you have to do something and it takes a couple of weeks. It's the same with the IPL treatments. They're a month apart. However, in between each month, you keep up with your skincare regimen and you actually see it working and right before your eyes. They always say it gets worse before it gets better. It's true of the IPL, but once it gets better, it's better and it's better and it's better. And it's just great to see the results. So
it's time to cure this thing. I mean, if there's a cure available, let's get this done.
Yeah, let's get it done.
And like we say, it's from the inside out. We'll do the diet, we'll do the topicals, we'll do the treatment, we'll do whatever
we work with you every step of the way.
So there you go. If you want to learn more about the IPL, you can look down at our playlist. And if you have any questions, please leave it down in the comments below. Of course, you can reach us on our website. Everything's down below in the and of course, look down in the that down bar.
Yeah.
And look forward to seeing you again in our next Wine and Wellness Wednesday. Thanks for joining us today.
Thank you so much. See you next week.